Imagine living life like a literal puzzle and constantly trying to put the pieces together. Imagine being asked a question and having to think about what was asked and how to answer. This could take a whole solid minute versus the 1 second it takes for others. Imagine not understanding social cues or the difference between inappropriate and appropriate behaviors. This is the life of an autistic individual. I have a sister who's on the spectrum, and my partner here also has a cousin who's on the spectrum. So we see these struggles almost every single day. It is because of our exposure, our interest turned towards a career as an applied behavior analyst, which is a branch of occupational therapy. This type of analyst works with many other social and intelligent disorders, but is mostly associated with autism.
To become an applied behavioral analyst, the minimal degree required is a master's. It is best recommended to have a bachelor's degree in psychology, education. When you go for your master's, the choices are psychology, education, or applied behavior analyst. Before you are an official applied behavior analyst, you have to gain a few years of experience in the field, then take the normal certification exam. Once you have passed the exam, you are an official applied behavior analyst. But some states will also require you to get a license. The average salary for an analyst is $69,000.
An applied behavior analyst uses the applied behavior analysis to help autistic individuals and many others with similar diagnoses to be more prepared for the social world. This type of analysis uses and manipulates the psychological ABCs, antecedent, behavior, and consequence, in order to bring out the desired behaviors and to de-promote the undesired behaviors. This is the type of therapy that is only scientifically valid to treat behavioral issues for people on the autism spectrum.
An applied behavior analyst, however, doesn't just focus on behavior. The analyst may work with speech therapists, educators, or other professionals to help the individual to improve in different fields. Some of these fields include communication, language skills, social skills, self-care, motor skills, academic and learning skills, and play and leisure. For example, the analyst may work with a speech therapist to decide what is the best way to help an autistic individual to improve in communication and language skills. The main goals of the analyst is to help the individual to become independent, confident, and successful. Together,
To make life less like a puzzle.